So welcome, everybody. My name is John Much. I am the chair of the Canadian Society of Professionals in Disability Management. I'm also the executive director of the Return to Work program at the WSIB. So on behalf of all the board members at the CSPDM, I want to say congratulations to all the graduates today. We want to recognize the time and effort that with your achievement, and now you're part of a community of professionals in disability management. Today we have an agenda that includes our keynote speaker, Mr. Scott Bouget, who's going to talk about the importance of professionalization within disability management. We're going to have a video that introduces our newly certified CDMPs and CRT-WCs. We're going to hear from Mr. Wolfgang Zimmerman, to give a congratulations from NIDMAR, and he's going to show us a video from the WDMA to update on the federal and BC initiatives, and then we're going to close. So without any further ado, it's my honor and privilege to welcome Mr. Scott Bouget, who is the Chief Operations Officer at the WSIB. For over 3 decades, Scott Bouget has been committed to serving people with workplace injuries and their employers. Scott's career within the WSIB has spanned many positions, from his early start as a claims adjudicator in 1990s, and I do remember those days. More recently, in March of 2022, Scott was appointed to the position of Chief Operations Officer after serving in the role in acting capacity during the previous year. Before stepping into his current role, Scott was Senior Vice President of Claims Management from 2020 to 2021, where he was responsible for more closely integrating case management, return to work, and health services to support improved outcomes. Prior to this, Scott was Vice President of the Health Services Division from 2016 to 2020, where he pursued the renewal of the WSIB's healthcare strategy. Scott also worked closely to support the president and CEO from 2010 to 2016 as the WSIB set out a plan to retire the unfunded liability and begin its transformation journey. Today, Scott and his experienced leadership team are focused on supporting the WSIB's continued modernization, improved outcomes, and simplified processes for customers, while also ensuring stability through the current COVID-19 pandemic for staff and stakeholders. The WSIB covers over 5 million people in more than 300,000 workplaces across Ontario and promotes health and safety in the workplaces with a goal of one day having 0 work-related injuries. So welcome, Scott.
And thank you, John, and everybody who's gathered here today. I did want to say as well, I appreciate. I want to acknowledge the work that, John, you do as chair as well. I think it's great. I know you took on that role a few years ago, and it certainly took it on with great enthusiasm and in the middle of a pandemic, as well as you were taking on other responsibilities here at the WSIB. So I wanted to thank John for that, and also thank Wolfgang, I know who's on the line with us today, for his continuing support as well on this really important work. So let me just begin by thanking the Canadian Society of Professionals in Disability Management and NIDMAR for actually allowing me to come and speak with you today. I want to say good afternoon to the graduates and everyone who's attending virtually. Last time I checked, I think we were up over 100 when I looked at the screen there. I want to say I appreciate a lot of the work you do, and what a privilege it really is to be here today. I know when John approached me about this a while back, I thought, what a wonderful idea, and how quickly time went in approaching up to today. But about the WSIB here, we have an important partnership with NIDMAR. We share a common purpose of restoring and maintaining workers' abilities using workplace-based reintegration programs, while also keeping the cost of these programs manageable for employers. And it's part of a larger overall system, which we're committed to meeting and exceeding the needs of workers and employers by adhering to fairness, integrity, and professionalism in all that we do. At the WSIB, we deliver public value to Ontarians by reducing the disruption and the devastation caused by work-related injuries and illnesses, while helping to make Ontario a safer place to work. And I know on both those fronts, that's nothing new to anybody who's certainly on this phone call, and the important work that's done not only by the WSIB, but all of our workers' compensation partners right across Canada. Here at the WSIB, we have to deliver our services in a way that meets the needs and expectations of people we serve and we work with. And one of the things we're always doing is asking ourselves questions. Some of those include, are we helping to make Ontario a safer place to work? Are we improving return to work and recovery outcomes for people with work-related injuries or illnesses? Are we meeting our customers' needs and expectations? Are we sustaining our organization through efficient and effective management? All super important questions, not just for us, but I'm sure for many of the organizations in which you work with as well. If we are set to deliver on return to work outcomes, we must come to a place of anticipating our customers' needs, focusing on complex and high-risk cases and making sure our staff have specialized training in serving all the people who rely on the WSB in their time of need. Ultimately, this means how we work and how we approach our work must meet those needs. While we are proud of our return to work outcomes, we know that we need to continue to find better ways to really deliver on the services that we do. And here are some of the things we're considering as we plan to move forward. First is, in this new era, digital offerings are a must, and I think that's something we've certainly seen through the pandemic, is just how digital has taken off, and I think we've learned a lot, both the pros, the cons, and the benefits of delivering services digitally. We'll enhance our customer experiencing by optimizing channels to better serve our customers. We're going to focus more on the complex and high-risk cases where we make sure to have the right people assigned at the right time and the right resources available to them. That's going to be a real core foundational piece of work that John, myself, and the entire team are going to be working on. We want to reinforce with our customers that we are promoting and leading in evidence-based best practices in return to work and disability management, which can effectively reduce the socioeconomic costs of disabilities for workplace parties, while at the same time maintaining employability for injured persons with disabilities. We are committed here at the WSIB to having a professional workforce in the fields of return to work and disability management with both national and internationally recognized credentials and designations. Our employees are thus seen by our customers to be professionals in these fields, which brings credibility and validity to the services we provide. We will continue to invest in our return to work team. Our specialized professional workforce have specific responsibilities and scopes and share a unified commitment to providing timely and effective support to help workers get back to work. As of today, our return to work program supports the annual maintenance of over 500, that's a lot, 500 professional credentials and/or designations within the fields of return to work, disability management, vocational rehabilitation, and other health-related sciences. We continue to support the attainment of CDMP designation by offering the CDMP exam prep tools and resources to all new employees. This is where today's CDMP graduates come in. You really do exemplify the future of return to work and health and safety. The professional competence you acquire through your CDMP designation is important to all stakeholders in this process. To the WSIB graduates here today, you are proof that the world of work is changing and the WSIB is changing and evolving as the world of work and case complexities change in it. By investing and upskilling our staff and return to work program, we are well positioned to support all injured ill workers, especially the most vulnerable. In closing, I want to thank the CSPDM and NIDMAR and everyone in your organization, as well as all the graduates here today. It's been a privilege to speak with you, and I look forward to your continued success.
Thank you, Scott. Very well. It does make me proud to work here at the WSIB, and our relationship with NIDMAR. It talks about a lot of good work that we're doing for sure. At this time, we're going to have a video to introduce our newly certified CDMPs and CRTWCs. Congratulations, everybody. So at this point in time, I want to welcome a man who needs no introduction, Mr. Wolfgang Zimmermann. Over to you, Wolfgang.
Great. Yeah, thanks a lot, John. Appreciate all the work that you and Scott, have been doing, and certainly goes without saying that we're extremely proud of our long-term relationship with WSIB, starting more than 20 years ago now, when we started working first with you and Judy Geary, and it's been carrying on and upwards from that. And I certainly want to, congratulate everybody who has achieved this designation and all the hard work and the effort that went into making this possible. And I also want to recognize the graduates for 2021 and 2020 that where we didn't have the opportunity, or certainly the disruption through COVID was such that we weren't able to organize a formal function, but we'll move forward with that. And I really just want to briefly just touch on a bit on the impact that all of you that have obtained the designation today can have. I mean, I'm dating myself, but thinking back when 45 years ago, more than 45 years ago, when I got hurt in a logging accident, first week on the job, and Scott talked about the importance of prevention when we sort of didn't have that. And the logging camp that I was at with 450 guys, we had a fatality every 18 months, and it was somehow accepted. And I think it's important that we recognize that we still have on average about 1,000 workers that die every year across Canada as a result of occupational accidents or occupational diseases. And the number of permanent disabilities is a multiple of that, around 25. So when the fact that I was able to get back to work was really a commitment from the employer and from the union, because we didn't have expertise. We didn't know how to accommodate. We didn't have human rights legislation. We didn't have codes of practice on accommodation, ILO standards. We didn't have UN best practice guidelines in return to work. We didn't have a UN convention on the rights of persons with disabilities. All these things exist today, and we have you are all a tremendous resource in advancing the agenda, so that individuals who acquire a mental or physical health impairment, especially now, since we're dealing with the fallout from long COVID. I mean, it's something that, the more we see about it on that front, about 30% of all COVID cases are expected to carry some form of long COVID, and all of you will be able to make a difference. And I think that's really what this is, what this sort of all comes down to, because across Canada and around the world, 80% of all disabilities, all mental or physical health impairments, occur during somebody's working life. And it's really the notion of being able to stay gainfully employed that makes all the difference. I mean, many of you have probably seen a fair bit of public discourse around the whole notion of a Canada disability benefit that is being advanced, and the fact that we have about 1.5 million Canadians with disabilities that live in poverty, and it's the ability to stay gainfully engaged. And I have had many conversations with certainly with our, and continue to have with our politicians. And when you are on average, when your monthly income is around $1,300, what does that really mean in terms of being able to maintain a gainful role in society when you don't have the income to support that and to be able to participate? So that's really the key, and I think that's where all of you are able to make a huge difference in trying to maintain that attachment to the workforce. We will, when we talk about disability inclusion doesn't happen if an employer doesn't accommodate their own workers who acquire mental or physical health impairment. We will never break down that barrier, the stigma that's attached to that. We see a recent survey in the UK where out of the 100 largest companies, 99 of them had disability inclusion as part of their mission statement, but less than half have actually a program in place. This is where CDMPs and CITWCs come into play at being able to bring up that professional level of support. And it's certainly something that, I'm extremely pleased that I've been able to, over the years, with tremendous support from many individuals, whether it's Scott, whether it's John, or many others, all of you across the country and around the world who believes that we can do better, that we don't need to have individuals resort to MAID, and simply if there's a way to accommodate them in some form or other and stay engaged, and that's happening everywhere. The number of countries, and you've seen the map earlier, which is the fact that we now have CDMPs in 22 countries, and that number is rapidly expanding. I was extremely pleased to see that Dr. Mohamed Azman, the chief executive of the Malaysian Social Security organization, was on October 28th, was elected as president of ISA, which is the International Social Security Organization, which has more than 300 member organizations in more than 150 countries around the world. And he's been a huge champion. We've had the privilege of working with him since 2010, and Malaysia now has well over 300 CDMPs just across their own country. And in conversations with them recently, the fact that they added individuals from Brunei, from the Philippines, from Thailand, from China, all of whom have gone to Kuala Lumpur, because the Malaysian government established a CDMP, CITWC, and Disability Management Education Center at the University of Malaya, which is the oldest university in Malaysia. And they're making a tremendous contribution in this regard. So I've been in touch with Dr. Azman since, and he's very, very committed in his new role at ISA to continue the work that his predecessor did in terms of Dr. Joachim Breuer, who was the CEO of the German Federal Workers' Compensation System, and in 2002 was the first international jurisdiction to license the CDMP as the standard. So, but the fact that they're committing, that the government of Malaysia is committing significant resources in terms of supporting training as well as certification and education all across the ASEAN region, I think speaks to itself in terms of this commitment. The other part, of course, that is very much rewarding for, I think, all of you is that, and for, I guess, for all of us really collectively, that after a few years, starting in 2014, of assessing the impact that CDMPs were able to have on return to work outcomes in Belgium, both CDMPs and of course CRTWCs, that the Belgian government has now, as of January 1st of this year, legislated this. Every return to work specialist working in Belgium, and it's a federal social security system that has about 400 and some odd thousand people with disabilities in its support. Every return to work specialist working for this organization must be a CDMP or a CRTWC. And because this legislation was introduced on and passed or formally introduced on January 1st of this year, individuals who work in these roles for organizations across Belgium have 2 years to obtain one of those two designations. So that's a fairly significant step in the direction that's based on evidence that the impact that all of you can have in achieving better outcomes of individuals staying in the workforce. The Scottish government is now following suit in this direction, and I understand that Malaysia will follow suit down this path as well. So congratulations, many thanks for all of your ongoing support for us collectively to make a difference. I mean, acquiring an impairment is not something that any of us plans for, but you have the skill to make sure that individuals with disabilities don't end up in despair, homeless, poverty, addiction, or worse. So now onwards and upwards. John mentioned earlier that that we were able to collectively and with the tremendous support of not only the WSIB but also the Saskatchewan board and the Alberta and a number of other large organizations obtain significant funding to support better return to work outcomes, which includes education, which includes professional certification support, which includes program assessments, as well as supporting research. And so in that context, we worked with a development firm called Staggering Media, which some of you may be familiar with, who had attended the IFDM 2018. Those were the folks that were cruising around, taking all the pictures and leaving us with a visual legacy. So Trevor Jansen, their creative director, created a video that promotes the assessment protocol, what it is and what it can do for you. And with that, we'll now roll the video.
Could you imagine losing 690 years of productivity? Well, that's what happened in 2019 because there was over 250,000 occupational lost time injury claims in Canada. At minimum, that works out to be at least 690 years of lost time. In 2014, the cost of disability-related absence was 2.4% of Canada's gross national payroll. That's $16.6 billion. With that kind of money, you could buy Pearson International Airport 3 times and still have $1 billion left over. In any given week, at least 500,000 employed Canadians are unable to work due to mental health problems. That's almost the population of Vancouver, British Columbia every week. And that economic burden is estimated at $51 billion each year. That's 10 international airports and $1 billion left over. Locally and globally, we're facing a massive economic, social, and public policy problem around injury and disability. The impact is not just limited to the injured and disabled employee, it also affects their families, their friends, and their coworkers. The net impact rapidly measures into millions of people and billions of dollars in the economy. So, How do we change this? How do we catch the people who are falling through the cracks and recapture all that lost time and capital? Well, the answer is in having an effective disability management program. To get an employer's perspective, we talked to Leslie Allen Reed, the Director of Absence and Disability Management at Fraser Health.
Disability management is both a cost avoidance and a retention strategy for employers. So your cost avoidance comes from reducing the cost of employees being off work. The most expensive part of a disability is the time lost from the workplace. Not only are you paying for that employee who's off, you may be covering them with sick leave or short-term or long-term disability, WorkSafe BC coverage. You're also having to replace that worker in the workplace. And sometimes you have to do that at overtime rates. So not only are you're basically paying for 2 people, possibly 2.5. And if you don't replace that person, then you've lost the productivity of that worker. So if I can help that person recover and get back to work more quickly by doing the right things at the right time to support their recovery, that time loss from work is less, and your cost associated with that becomes less. From a retention point of view, your people are your most important investment. And so if you have a strong disability management program, when one of those important resources gets hurt, gets sick, gets injured, and you're helping them get back to work in a timely way, they're going to see that as being valued by the organization. And that retention of that person, that skilled worker, that knowledgeable person who knows your work and business and has that experience, then is better for you business-wise. It's probably easiest for me to give you an example in real life. So at Fraser Health, we did some redesigning of our DM program a couple of years ago with a focus on early intervention for musculoskeletal and mental health issues, really trying to focus on getting people connected with services and supporting return to work as early as possible. We actually improved our return to work percentage of employees that return to work before 150 days, which is the start of our LTD plan, by 20% over 2 years. And so in turn, that reduced our LTD claim rate. When you do the math on trying to determine, well, what does that actually equate to? If our claim rate had stayed the same, we would have had almost 300 additional claims in the system that we avoided by having better outcomes up front and early intervention. And at a place as large as Fraser Health is, that equates to just over $10 million in 2 years.
A savings of $10 million. That's an amazing result simply by using cost avoidance and employee retention strategies through effective disability management practices. Saving money and maintaining your staff are great, but there's also another major thing for organizations to consider in the near future: compliance.
Recognizing the member for Saanich North and the Islands.
This legislation creates a framework that this is a process that's an ongoing process. Future parliaments are going to continue this important work.
We announced a new accessibility regulation taking effect on September 1st that requires over 750 organizations to start establishing accessibility committees, accessibility plans.
Federal and provincial governments are creating legislation like the Accessible British Columbia Act and the Accessible Canada Act. These pieces of legislation require government departments and Crown corporations to think about and accommodate persons with disabilities. It is also the future for the private sector. So at this point, I hope employers are asking themselves, how do I get a cost avoidance and employee retention strategy that also brings me into compliance with legislation? Well, the National Institute of Disability Management Research has grants and support for organizations that want to evaluate their accessibility and disability management practices. The best first step with this grant is a snapshot assessment to figure out where the organization stands in relationship to best practices. This process is called the Workplace Disability Management Assessment. And these assessments are open to any type of employer. It doesn't matter what level your disability management practices are at. You just have to be willing to have the conversation, because this assessment covers 16 areas of discussion in 72 questions. They provide a roadmap to either create a disability management program or enhance an existing one. The grant available for the Workplace Disability Management Assessment is incredibly valuable, saving organizations tens of thousands of dollars, and it lays the framework to foster a consistent and engaged disability management process throughout your organization. But what does it actually look like to have effective disability management practices within your organization? We've asked a certified disability management practitioner to talk about her role.
Having a disability management client partner within your organization allows you to have that single source who comes in with a different lens, bringing in knowledge, experience, and impartiality that allows you to have better outcomes for everybody. Human resources is a very structured and rigid role. Disability management comes in with the breadth of understanding of those policies, those procedures, but is trained to have that creativity to color outside the lines and be able to come up with a reasonable accommodation that benefits everyone. Let me give you an example. I worked with a client who had a medical condition that simply stopped her from being able to work a certain part of her schedule. It was quite simple in terms we just wanted to be able to ask if anybody else was willing or interested to change with her. But because of rules, collective agreement, both HR and the union made it very difficult to ask a very simple question. Because it was a reasonable accommodation, we were able to ask a simple question. And because of that, we were able to find someone who wanted those shifts. And therefore, the employer was able to retain their employee, and that employee was able to stay connected to their workplace.
So what do you get with effective disability management? Reduced claim duration, significantly lower long-term disability rates, a reduction in replacement and training costs, and you get your employee back. All of these benefits are proven returns on investment of $5 for every dollar spent on effective disability management. 5 to 1. Not even the most optimistic stockbroker can promise that kind of return on investment. Now, if you're still feeling a little hesitant about applying for the grant to do the Workplace Disability Management Assessment, I can still think of a couple reasons why. First of all, let me say that we're not here to point fingers and to tell people that they haven't been doing their jobs. In fact, the assessment is a supportive and confidential discussion with a consensus-based approach. And the only person who gets a copy of the report is the person that requested it. Or maybe you're asking, how much time do we have to devote to this? Well, the assessment involves phone interviews with about 8 to 12 people, depending on the size of your organization, including both HR and union perspectives. That's it. It's not endless meetings that could have been an email. What you should be asking is this: how is this an opportunity? By applying for the grant and doing the assessment, you will be leading the way to a streamlined disability management process in compliance with federal and provincial legislation, lower LTD rates, and a better relationship with your employees and union. How many people can put that on their resume? But don't take it from me. Let's hear from someone who went through the assessment with a grant to improve their disability management practices.
I'm Catherine Gordon. I'm the Director of People and Culture at Canuck Place Children's Hospice. At Canuck Place Children's Hospice, we try and care for our staff the way we care for children and families. So when we were approached by MAR to do the workplace disability audit, we were super excited because we didn't have the funds as a nonprofit to do that ourselves. So it was an amazing opportunity. And it confirmed that we were actually following best practice, but also identified some gaps that we could do to support our staff even more. The process itself was really easy. So I think anyone, regardless of sector, should be looking into this program, especially as it doesn't require any extra expense. NIDMAR provides the expertise that most organizations don't have internally. With the grant process right there, it's inexpensive to access that expertise to really fully support your staff. So I wholeheartedly endorse this program.
NIDMAR is a world leader in disability management and is offering grants worth thousands of dollars to do a workplace disability management assessment with your organization. Take advantage of this opportunity by going to nidmar.ca and looking at our audit services, or send an email to nidmar@nidmar.ca.
If you're an employer who either doesn't have a disability management program at all, or you do and you're looking to see whether or not it contains all the components it should to give you the bang for your buck that you're looking for, staff retention, cost avoidance, take advantage of the workplace disability management assessment that's being offered. There's no downside. It's, you know, there's grants and things available that there's no cost, and you're going to learn something that you then have the opportunity to make changes that are positive and have incredibly positive outcomes.
Thank you, Wolfgang. That was quite a powerful business case to everybody that wants to improve on their disability management programs with some really solid solutions. So thanks for introducing that. In closing, I want to, again, congratulate everybody that has graduated today. I do want to say that today is not possible without the support of our board members, and particularly with Olivia, Jennifer, and Lanny, who helped really support today's session. So thanks to them. But membership has its privileges. And I just want to say that we have some upcoming webinars. One with the Chief Accessibility Officer, Stephanie Cadeau, will speak to us about her role and what she hopes to accomplish. And again, that's on December 15th. And coming soon, we are in the process of developing what we call a disability management solutions platform. We're just in fine-tuning the enrollment process, so look out for that. We do have a website you can explore. If you have questions, reach out to the board and participate in surveys and any research that comes your way. So with that, I hope everybody has a good day. I want to thank our speakers today and have a wonderful day going forward.